Prostate removal is life-saving, but it comes at a cost. What happens to your sex life and bladder control after surgery? Today, I'll explain the consequences and solutions. Now, here's one thing up front that you have to understand. Prostate cancer is the only reason for that. When benign prostatic enlargement is surgically treated, only the central part of the prostate gland is removed. The rest of the gland will remain untouched. This means that prostate removal has more potential negative consequences. I know from experience that many men are not aware of those. So let's dive right in and shed some light on the issues involved and solutions. My name is Dr. Stefan Buntrock and I'm a board-certified urologist and specialist in sexual health. Here is one question I often get. When there is cancer inside the prostate, why not just remove the tumor and leave the rest alone? Why take out the whole organ? The answer is simple. It's for safety reasons. In many patients, there is tumor growth in several places throughout the prostate. It is not possible to identify them before an operation. This can only be done under the microscope after surgery. In addition to that, the operation has a high degree of difficulty. I don't even think it would be possible to safely cut out parts of the prostate with the technical means we have at this moment. Basically, radical prostatectomy poses a risk for two important functions: urinary continence and erection orgasm. Can they be preserved? I will tell you about it in a minute, but this is what I mean by the operation being technically demanding. There are nerves running left and right close to the surface of the prostate. These nerves are responsible for penile erections. They also send branches to the inner parts of the urinary sphincter muscle. Surgery in that area threatens nerve function. If the nerves get damaged, it will result in complete erectile dysfunction. It may also result in worse outcomes concerning urinary continence. This is why a nerve-sparing approach is so important. In nerve sparing, the nerves are carefully preserved to keep them intact. However, despite the greatest care, just touching them will have the same effect as touching a mimosa. You know, that flower that rapidly folds its leaves when you touch it. The nerves display the same spirit. Well, they don't fold, but they cease to work properly for some time. It can take up to 2 years until they work properly again. Enough time for damage to develop inside the penis due to the lack of nighttime erections. I have separate videos on that topic, by the way. If you enjoyed the video so far, please take a moment to subscribe to UroChannel and give the video a like. Liking and subscribing is like clapping your hands after hearing a talk. But on YouTube, admission is free. And also liking and subscribing doesn't cost you anything. Thank you. Back to nerve sparing. Nerve sparing is not always possible. When the tumor is located at the border of the prostate, nerve sparing may be too risky. There could be some tumor left inside the body because of that. In these cases, the nerve on the other side is spared. Of course, it is best to have both nerves in place, but one is better than none. Despite all efforts, it is not certain that erectile function will return. The older you are, the higher the risks for that. The body doesn't regenerate that well beyond the age of 60. There are ways to increase the chances for that called penile rehabilitation. I will link you the videos about my approach at the end. What about orgasm? What about incontinence? I mean, nobody wants to run around wearing diapers. Let's start with orgasm. The nerves for orgasm run separately from the erectile nerves, but nevertheless, orgasm may be altered. Ejaculation will be lost due to the operation. The prostate and seminal vesicles are removed by the operation. Both structures are responsible for the ejaculate. So semen volume will be zero while the feeling of orgasm may remain unchanged. But not only sexual function, but also urinary incontinence is in danger when the prostate is removed. The prostate is located just beneath the bladder neck and above the urinary sphincter muscle. Luckily, because of surgical progress, permanent incontinence can be avoided in most cases. The surgeon you choose is the most crucial factor in continence outcomes. However, all men must be prepared that they will lose small amounts of urine during the first 3 months after the operation. It is uncommon that men stay completely incontinent. To increase the chances for better outcomes, I am all for pelvic floor strengthening exercises in this particular patient group. You know that I am more critical otherwise. In my office, none of my prostate cancer patients has a major problem with urinary incontinence, but some of them leak a little with straining or coughing. That can be managed with incontinence pads. I know that many men are not aware of these consequences. This is why I am posting this video. In my opinion, nerve sparing is key. The earlier a diagnosis is made, the better the chances that nerve sparing can be offered. The quality of life after the procedure is excellent for most men. But I think that some areas need careful planning beforehand. Nerve sparing is one topic. Pelvic floor training and penile rehabilitation are the other ones. If you or someone you know is facing prostate surgery, check out my video on penile rehabilitation. It could make all the difference. Click here to watch now. Thanks for watching. Bye bye.